Hello again, Mike Karegeannes here, physical therapist and TMJ Specialist. I've got Molly here with us today, who's been kind enough to be a model for us to give you an idea of some of the initial soft tissue work that we would do with someone who comes in with any pain or issues with the temporomandibular joint. In this particular case, let's say maybe someone who presents more as a muscular type of TMJ situation. So two of the primary clenching muscles that we're going to address in this video is the temporalis muscle and then the masseter. I always call the masseters kind of your chipmunk cheek muscle that you can see if people are big-time clenchers or bruxers. But one thing I want you to think about is the temporalis muscle on each side of our head is very large. I mean, it covers a huge portion of the right and left side of our skull. And of course, it's a very powerful muscle, right? To break up nuts and our hard, crunchy, chewy foods, beef jerky, bagels, anything, your French breads, those type of things. So it gets used a lot. We do see quite a few people, especially sometimes our children and teens, with what we call bilateral temporalis type of headache. Surprisingly, it can be a lot from a certain type of parafunction like nail biting. So repetitive nail biting, I try to explain, is repetitive micro trauma and overuse to the temporalis muscle. So for some people who either clench and grind too much or might nail bite, or sometimes they'll bite the cuticle, or maybe they'll chew on their lower portion of their lip, you can really overactivate this muscle throughout the day. And then, then days become weeks, weeks become months, and all of a sudden, maybe 6 months, a year, 5 years later, you start having, bilateral temporalis type of headache. So one thing I want to make you aware of is one way that I like to try to at least isolate where I find the temporalis muscle to be the largest or more hypertrophied is I'll just gently say to someone, please bite down for me. So bring your back teeth together, assuming they have a relatively normal occlusion or bite as to how their teeth come together. So bite again, Molly. And as she bites, what I'm feeling for initially is the anterior portion or the front portion of the temporalis muscle. And if maybe I move my hands out of the way, you might be able to see here. Go ahead and bite again, Molly. Clench down, relax, and clench again. So right in through here is where she gets some decent contraction. Bite again. I also like to gauge, does it feel symmetrical on both sides when I'm palpating? Sometimes you'll notice the left side contracts very well, but not on the right side. Sometimes that then gives me an indication as to what might be going on with their occlusion, that it's not very symmetrical. Again, that's going to get out of the scope of this, but I pick up a lot of information just from having the patient do that. And then what I will do is start to palpate perpendicular to the orientation of the muscle fibers. I'll do one side at a time. And again, we kind of train our fingers, depending on the literature and what you choose to follow, maybe 1 to 2 kilograms of pressure. Obviously, I can push firm and hard enough on anybody to make him uncomfortable and painful. That's really not the goal. Ideally, with a reasonable amount of pressure, 1 to 2 kilograms, most people should not be painful or sore. If they are, that's an objective finding, something we're going to want to work on and treat, and over time, reduce that sensitivity and tenderness to touch. Then I'll move my fingers over to the medial portion or the middle portion of the temporalis, and I'll say, okay, Molly, please bring your teeth together again and bite, relax, bite again. And I can feel, which you can't tell through her hair, but right here is where I feel the bulk of the middle portion of her temporalis tendon. And again, I would do one side and then the other side, kind of palpate along the entire portion that I feel contracting and get a sense of, is it painful, is it tender? Not uncommon, sometimes the temporalis muscle can refer pain to the teeth as well. So assuming a dentist screened the patient well and they've deemed that their teeth are fine and healthy, there's no cracks, no sensitivity, a lot of times you can get referral to the teeth through the temporalis muscle. And then the other portion that I like to check is the posterior portion of the temporalis, which tends to be, sort of behind the ear area. And I'm going to ask Molly to please clench again and relax, clench again. And in her case, I feel a little bit more contraction on the left than the right side. But definitely, nonetheless, there's a little contraction occurring back in here. So that's one way to just kind of tease out anterior, middle, and posterior. I think I often see therapists and clinicians, they're in such a hurry to get this done that they really miss a lot of information here. And they might just say, well, because you're not tender here, your temporalis isn't part of the problem. But then you find out people are very tender more in the medial portion. So again, everybody is different. We're all unique human beings. Neuromuscularly, how our teeth come together can all affect which portion of this muscle that we will contract. And then I will go in and systematically, if I find an area that's tender, you could do something that's called like cross-friction massage, perpendicular to the muscle fiber. Again, a reasonable amount of pressure to increase blood flow and circulation, but obviously, I don't want this patient in too much pain, but it may be somewhat uncomfortable. I always try to use a rating scale of 0 is no pain, 10 is severe. If you try to keep it at a 3 or so. So low level, but yet where I can be effective. I can also just very gently use the heel of my hand, right? So if direct pressure with my fingertips is too intense, if I use more surface area, I can sometimes be much more gentle here to try and desensitize the tissue, increase the blood flow. This will be the very same thing that I will show the patient to do at home as well. Sometimes we can get in here and I can just find the area that's tender, and I can just do, which might be hard to see with my fingers, but just a very gentle myofascial stretch. So meaning that I'm applying some downward pressure and then separating my finger or fingers to get a nice stretch on the fascia and see if we can get things to release that way. And I've seen therapists do, and you certainly could, a hair pull to indirectly try and get at the fascia and the tissue that's around it. Obviously, we have other things at our disposal like dry needling, laser treatment that we have at Freedom can also be very effective for some of these areas. One thing I do want to make mention of, about 2 years ago, I had a wonderful opportunity to do a head, neck, and jaw cadaver dissection class here at my clinic at Freedom Physical Therapy in Fox Point, Wisconsin, with a very famous dentist and anatomist, Dr. Tanaka. And I can't tell you how much fascial tissue and thickening there is around this temporalis muscle. So it also can be tough to get through and to stretch. There's also various different intraoral techniques that we will get to, but I won't cover in this video. Also, please know that the temporalis tendon then does course underneath our jaw, our maxillary arch, or we call it our zygoma. It courses underneath this bone and eventually attaches onto the jawbone right around in here. So not uncommon that while people might be sore here, they also develop temporalis tendinitis that we would palpate intraorally. And then the next thing I want to just cover a little bit here is the masseter muscle. So you heard me mention earlier the masseter muscle runs from the zygomatic arch here all the way down to the mandibular angle. So it runs a pretty big distance. Some of us will distinguish the superficial masseter from the deep, which is a little bit further back into the joint area. For all intent purposes, right, I'm going to scan the whole muscle in the area. I'm looking for tender points, right, trigger points, possibly any tender point that the longer I hold it, I recommend at least about a 20-second hold time. Then you might start to get an expression or an expansion of the pain, sometimes within the muscle itself, or it might refer to other areas. The masseter also can cause tooth-related pain as well. So if you're having tooth pain, and again, your dentist has cleared and screened that your teeth are perfectly fine and healthy, it's very possible that you need to get some good muscle treatment through this area to eliminate that. So I will work on, again, these are both clenching muscles, right? So the masseter and the temporalis help us bring our jaw together. So you can probably see if I have Molly once again clench and relax, clench again. You can see the masseter muscle and you can feel it. Clench again, contract. And again, Molly's teeth seem to come together pretty well and symmetrical. I feel a pretty even girth and size and contraction and equal timing of her masseter on each side. So again, the muscle runs in this direction, right, more vertical. So I could get in here and screen the muscle from the zygomatic arch all the way down to the angle perpendicular to the muscle fiber and assessing for what I might feel would be a tender point or a trigger point. And keep in mind, right, we always want to make sure that these tender areas, is that the pain the patient's familiar with? So that's always a key question. Like, is this kind of where you feel your symptoms? Yes, it is. No, it's not. Right? Sometimes it can be a dormant trigger point, so meaning sort of more inactive. The patient didn't even know they were sore there until you actually push on it. And again, I really try to apply the same principle, 1 to 2 kilograms of pressure through here. You could also, have them turn their head, and I could, again, try and get in here and just do a very nice, sustained myofascial stretch. Or I could ask her to please open her mouth, and as she opens her mouth, do sort of a more glided with either lotion or no lotion, or just get in here and do a very gentle, sustained myofascial stretch through there. So all kinds of different soft tissue techniques can be applied. If you're an instrument therapist, Graston, that type of thing, there's all kinds of different ways to go at this. And as I mentioned here, we will dry needle up in here frequently. We can also do dry needling therapy to the masseter muscle. And then what I like to really do intraorally is I will come over my patient. I'm going to have them open gently, obviously get their permission to enter their oral space. And I will come in here and educate them on how to find this muscle themselves. So when I'm in here, just the more cheek portion, this is the buccinator in that area. That's really not what I'm targeting at the moment. You actually have to go all the way back till you hit the front of the ramus or the jawbone. And between my thumb on the inside and my index or middle finger, I will start to basically grab or lift the masseter muscle off the bone and knead it and massage it. I can either do, again, a cross-friction massage like this. I can just gently knead it, and as I knead it, I stretch it in a downward fashion. So I can have Molly open again. I'll come in here. I'll say relax, clench if you don't know, and then, there's that muscle. And honestly, everybody makes fun of me when I lecture, but I do call it, it's like the fillet of your face. It feels like a nice little filet mignon, a little piece of steak here. And I will clench again once, relax, so I know I'm directly on it, and I will knead and massage this all the way down. Again, constantly checking in with them as to trying to keep it around a 3, not much more than a 4 of pain or discomfort, and over time work to really desensitize the tissue and break up any trigger points that they might be experiencing in this area. And then again, I will show them how to do self-care technique at home as well. So that's kind of my brief coverage on the temporalis and the masseter muscle and their contribution to muscular pain as it might relate to headaches, TMD or TMJ disorders. Thank you very much.